Hey gang, Dr. Kevin Jiggins at Advanced Spinal Care and Rehab in Cambridge, Ohio. I'm going to talk to you again today about low back pain. Why do I keep harping about low back pain? Well, because it's an American epidemic that's happening all the time. Now, you've also heard me talking about getting up off the floor. I was talking with a friend of mine, Charlene, shout outs to you, and she's on the floor all the time, and she's my age, and she's able to get up and down, But yet and then the funny thing is, she says that where she works, that they need to keep items higher because people are incapable of bending down and getting back up effectively. Okay, so what's causing that? First and foremost, our diet is horrible as Americans for the most part, and as a result, we're getting fat, and I'm using the word, overweight is wearing on our joints, wearing on our back, and pulling on our spine, causing these problems. So first and foremost is diet is affecting our ability to move. We have to move in order to stay healthy. Our joints do better with movement. Now, we can also pound ourselves in the ground by doing too much of a bad movement, meaning we've gotten ourselves into a situation where we're physically compensating biomechanically for bad body posture, bad positions. Now, we as Americans tend to spend a lot of our time sitting. Okay, so this is us sitting, this is our low back, right here. What ends up happening is our hip flexors end up getting tight, and as a result of that, we can't get all the way back vertical. Also, there's another thing called reciprocal inhibition. I'll talk about that next time. It causes us to lose our gluteal strength, our butt muscles aren't as strong. Then our low back and our hamstrings have got to do some of that extension work. So, first and foremost, we need to ask ourselves, are we capable of getting up off the floor without having to grab onto something and move? Watch the babies. I tell this all the time. The toddlers at where my wife works, these little babies, learning how to walk and getting their favorite sitting position is not sitting on the floor, but actually going into a full squat, which is what... All right, Patrick, I hear you too. I'll go on it. I'll go to that in just a sec too. But they go, sorry, I was reading a live thing and I was getting some information. But they squat. Most of the world squats as opposed to sitting down. Okay, now let's talk about a couple other things really quick that was just brought up. And yes, Mac, your spelling sucks, but that's fine. Wallets. Are we sitting on a wallet? We don't walk with shoes with two different sizes, and crappy shoes another thing. Yes, it is distracting. If we're sitting on a wallet, and this is under our tuchus, what's that doing to our hips when we're sitting down? We're sitting like that. What's that do to our hips? It rotates one forward, one back. We end up with what we call a functional or an acquired leg length discrepancy. This causes us to walk inappropriately. So we don't want to sit on a shim. That would be the equivalent of driving with one tire different sizes than the other three. And what does that do to the car? It's going to wear things out. That's going to cause problems with our low back. I learned that in chiropractic school. I couldn't figure out why my adjustments wouldn't hold. And then somebody said, well, you're sitting on 1.5 inches of wallet. What does that do? Okay. Bad shoes. We need to make sure that we're replacing our shoes regularly if they're starting to wear. Get good shoes. Shoes are one thing that I tell people you need to spend money on. If you're going to spend money on clothes, it needs to be on shoes. Shoes last longer than the rest of our clothes. We use them more than the rest of our clothes. And it's also the thing that helps with our posture. You know, a new shirt's not going to help you with your posture, but shoes will. So, those are the things to think about for today. Keep firing questions at me. I appreciate those that participated today, Mac especially, and Charlene, thanks for the good idea. She is a champion of getting up and off the ground. And so keep at it, guys. Kevin Jiggins, Advanced Spinal Care and Rehab, Cambridge, Ohio.